Socialita is a smart, healthy 2-year-old and very, very charming. But there was a time when her parents thought she might not live to see another day. Juan and Xochitl are like many immigrants. They left their home and family in Mexico to find work in the United States. Had Juan been working anywhere other than Emory, Virginia, baby Socialita may not have survived. But there's compassion in Emory. It shows in the Migrant Health Network of Southwest Virginia. Through this organization, Spanish-speaking outreach workers discovered Socialita's pneumonia and got her to the hospital for treatment that saved her life. Thousands of migrant workers like Juan come to Southwest Virginia each year for seasonal work. In the 1990s, community volunteers began teaching English to Mexican workers each Sunday afternoon at Emory and Henry College. They soon recognized that these hard workers and eager learners had no way to take care of their medical problems. That's when Mary Bell Boltwood and others organized volunteer doctors and nurses and set up a free medical clinic on Sunday afternoons at the College Health Center.
The most amazing thing that we found when we started the Migrant Health Network was the generous spirit with which the community responded, starting with Emory and Henry College, the various doctors and nurses that volunteer with us, the health departments. Everyone that we've asked has really pitched in. And from there, the program has really become quite successful.
Today, the Migrant Health Network has grown and works with 4 community health centers. Support comes from the Bureau of Primary Health Care, and the migrants pay according to their income. These clinics serve hundreds of migrant farm workers who come to the area to work long hours in tobacco fields, cabbage patches, orchards, tree farms, and strawberry fields. Our country depends on their labor.
70 to 85% of all migrant, of all the vegetables and fruits in the United States come to us, are put on our table by migrant workers, and our entire economy would collapse without them.
In addition to farm injuries or other health problems that go untreated, migrants could have high blood pressure or diabetes and not know it. But what do you do when you speak English? In most of the country, help would seem impossible, and the worker would just hope the problem would go away. But here, health workers reach out in Spanish. They go to the fields and give blood tests and blood pressure checks. They offer clinic appointments and transportation. Ephraim was able to explain his jaw injury in his own language at the Saltville Clinic. Health providers took him to the hospital for x-rays and follow-up care. But problems are often more serious than Ephraim's. When the Migrant Health Network heard about a sick man in a bunkhouse, they discovered a case of severe appendicitis. It is not an exaggeration to say that the network saved his life. Who is more deserving of help than the backbone of America's agricultural workforce? These migrant farm workers, who remain one of our poorest populations, whose minor health problems often become serious.
These guys work very hard. Right now the weather is absolutely perfect, but they'll be out here when it's 100 degrees and 100% humidity, and they'll be doing the same thing. They'll be working real hard.
Without health care, a broken bone, an infection, asthma, or pesticide poisoning can become deadly. Imagine having no one to turn to when you're sick. Millions of Hispanic farm workers pray to stay healthy as they move through this country every year, almost unnoticed, just like the crops they plant and pick. Dr. Jacinto Alvarado says that the Migrant Health Network makes Southwest Virginia special.
Getting comfortable coming to see us in most of the circumstances. And if we don't provide this service here, I don't know who could.
The Migrant Health Network offers visits to the doctor and a much broader sense of health. After the workday is over, outreach workers might be there, teaching migrants how to protect themselves from disease, from the heat, and from poisonous pesticides. They make sure the workers have blankets or warm clothing. Sometimes they help with food and nutrition. When migrant workers come with families, the Health Network helps guide them to community services. At health departments, Women get family planning and birth control. One Mexican woman's health screening revealed cervical cancer. Outreach staff arranged her successful surgery. Another life saved. Outreach workers make sure that babies get proper care and nutrition for physical health and intellectual growth by referrals to programs like Head Start. Minerva, whose husband works on a farm, is one of the network's great success stories. She is getting help to make sure that her daughter is prepared for kindergarten. Head Start selected Minerva as Mother of the Year for her exceptional efforts to attend classes and motivate her children to learn. Minerva's older daughter became a reading standout during her 4th grade year in elementary school. Some Mexican immigrants are now taking over some of the responsibility for educating new workers who come to the area. A new advisory board is spreading the word about the Migrant Health Network. These community leaders share information about health care or general survival in the area. These workers often find full-time work and with their families become permanent members of our community. Because these laborers quickly master technology and assume important responsibility, employers need them. Their labor puts food on our table. Their income contributes to a strong economy. When they grow and develop in a caring community, they strengthen our neighborhoods. We learn from them. The Migrant Health Network knows that by making the lives of migrant workers better, they improve all of our lives. Giving basic health care and information brings dignity to deserving people. The end result is a better Southwest Virginia and a better world.